Continue with our special series, Africa Battles COVID-19. Several African countries have come up with stringent measures to contain COVID-19. Today, Lindy Ntongana looks at some of the intervention measures being implemented by African governments.
Our special series, Africa Battles COVID-19, continues. Now, several African countries have adopted stringent measures to control the spread of the coronavirus. Countries like South Africa, Senegal, DRC, Egypt, Kenya and Nigeria have found themselves at the forefront of the battle against the disease. Well, as the medical world races to find a vaccine for COVID-19, public awareness is proving to be key in countries like Nigeria in halting the spread of the disease. Deji Badmus tells us more.
It's the resumption of work for the day at this SME in Lagos. Since Nigeria confirmed its first case of COVID-19, this has become a daily routine at this office. Workers must first use the hand sanitizer before they move into the main office.
Since the news broke out, we have sanitizers at the office, which we use regularly. As long as you are inside the office, or as long as you're coming into the office, you're expected to use it. And even once you step out and you're coming back to the office, you're expected to use it. So we use it almost every time. As long as you are in the office, you're expected to use the sanitizers.
The constant use of hand sanitizers is part of a broader public awareness campaign launched by the government in the wake of the COVID-19 outbreak in Nigeria. And that campaign has since been intensified across various media platforms in the country.
The electronic billboard behind me is one of the multimedia platforms being deployed for the public awareness campaign. Its strategic location at this very busy road intersection means anyone passing through this place would not miss the message. And then millions of people pass through this area on a daily basis.
We need the government to provide more of this, so as to create awareness for the over 20 million of Lagosians.
There are fears that if there was any massive COVID-19 outbreak in this country as seen elsewhere, Nigeria's vulnerable health infrastructure would find it extremely difficult to cope. It's a reason why the country is investing time and resources on public awareness campaigns.
We don't have the isolation center, or quarantine places that can take charge of a large number of people. And we know that this number can double within a short period. It can triple and quadruple within a short period. So what we need to do is, like as we're closing schools, as we're preventing people from going to churches, we have to strengthen campaigns in different languages. It must be as local as possible.
The campaigns are achieving positive results. For instance, awareness in Lagos, Nigeria's commercial capital, which was the first to record a confirmed case of COVID-19 in the country, is relatively high.
Personally, I've been taking the precautionary measures that we are asked to take, like wash our hands steady, go with your nose mask. Just like myself, I don't have any nose mask, but I make use of my hand sanitizer. Anywhere I get to meet a stand where water is available, I wash my hands and make use of this, my hand sanitizer. It's always with me.
But there are so many places in this country where so much still needs to be done to get the people better informed about COVID-19 and the measures they need to take to protect themselves.
And here is one such place, a remote community in the northwestern Kaduna state. Villagers here know little about COVID-19 and how to avoid infection.
To tell you the truth, we know nothing about the virus. We only just heard there is a disease that kills people and that if you contract it, you will die. But honestly, I don't know the name of the disease.
There are many communities like this scattered across the country and almost completely cut off from the public awareness campaigns seen in major cities like Lagos. Such communities also have poor health systems and education levels remain low.
I expect the local government people to be on the streets, ringing bell, directing people, telling them what to do, and also, if it's possible, for them to install hand washing instrument or capability in some key public places, that people can just easily get there, put water in their hand and wash, and move forward and pick leaflets if they need to read about it.
Then there's the danger of conspiracy theories. If left unchecked, they can hamper campaigns to tackle the spread of COVID-19. For now, the Nigerian government is focusing on enhanced awareness and tougher measures to curb the spread of the pandemic. Deji Badmos, CGTN, Lagos, Nigeria.
For years now, the Democratic Republic of Congo has battled the deadly Ebola virus. Our correspondent brings us this report on how the country is now handling the outbreak of yet another infectious disease.
In August 2018, the DRC's health ministry reported an Ebola outbreak in the eastern town of Mangina. It was the country's 10th Ebola outbreak, and it turned out to be the world's second worst after the West African epidemic of 2014. More than 2,200 deaths were recorded in the east of the country. The last Ebola patient was discharged from a hospital in the eastern town of Beni earlier this month. But the disease has left many families in pain.
I lost 13 of my relatives to Ebola. My mother, aunties and children all died from that disease. Only 4 of my relatives got cured.
At the peak of the outbreak in April 2019, more than 100 Ebola cases were being reported every week. According to the Ministry of Health, no new case of Ebola has been recorded over the past 4 weeks. But the country is now struggling to contain the coronavirus. More than 40 cases have been reported in the capital, Kinshasa. That frightens Stephanie Mastaki, who witnessed the suffering caused by Ebola.
This new disease with a strange name has really scared us because we lost relatives to Ebola. It has changed the way I live. We've been told to keep washing our hands at all times.
Mastaki advises her fellow citizens to follow safety instructions issued by health experts to avoid catching the coronavirus.
We should maintain high standards of cleanliness and always wash our hands. People should avoid crowded places and keep a distance of about a meter when talking to other people.
The healthcare system in the DRC has been weak for many decades due to conflict. That has given some citizens reason to believe the government won't be able to handle the COVID-19 outbreak.
Our government had deployed health officials at our airport to screen all passengers coming into the country. I find it puzzling that they failed to detect the coronavirus in a traveler who came from France. That shows how weak our surveillance is.
The DRC government has suspended flights from countries with many cases of coronavirus and ordered the closure of schools, bars, and other public places to limit the spread of coronavirus. But that has raised concern about the livelihood of low-income earners who live from hand to mouth.
So it behooves upon the government to ensure that at least the people will be fed. And for that to happen, a comprehensive plan, should be designed to see how the city will continue to be furnished with food and how this food can be made available to the population.
The coronavirus outbreak has further put a strain on the DRC's already overstretched healthcare system that's struggling to contain other diseases like measles, polio, cholera, and monkeypox. Chris Sachamringa, CGTN, Kinshasa, Democratic Republic of Congo.
As more and more cases of COVID-19 are confirmed in South Africa, response measures, including education and training at designated hospitals, are becoming more urgent. Angela Coppola has more from Johannesburg.
There are a couple of priorities that need to be managed in the process of treating a COVID-19 sufferer. A possible COVID-19 patient is identified at a port of entry using temperature scanning equipment. The patient then waits at the airport clinic for a team from the National Institute for Communicable Diseases. The emergency response team arrives to take the patient to a designated hospital. At the hospital entrance, an isolation team takes over and escorts the patient to an isolation ward. The patient's recent travels are noted, as well as their medical history. The team draws blood and sends the sample to an NICD lab for processing. If the results come back negative for COVID-19, the person is discharged. If the results are positive, the patient remains in isolation. The team monitors the patient's vital signs and administers medication. They observe the patient for the next 14 days or more and continue to test the patient's blood. After the isolation period and once there are no more symptoms, the patient has then recovered.
On the continent, Egypt continues to bear the brunt of COVID-19, reporting a significantly high number of cases. And as those numbers continue to rise, the country is working to beef up its capacity in its health facilities.
Every plane arriving in Egypt used to be greeted warmly. Flights from abroad meant good business for a nation that relies heavily on tourism. But that was before the COVID-19 pandemic. Now every arrival raises worries over the possible spread of the coronavirus.
For long, the Egyptian quarantine facility at Cairo Airport has been known to take extreme measures, and we're still looking for other diseases other than COVID-19. We take tough measures because it's part of our job to take care of the health security of the country.
When they arrive, all passengers must get checked for fever. They're also obliged to fill a form with their address and contacts. Quarantine officials are then supposed to follow up their progress over the next 2 weeks. Before entering the main hallway of Cairo Airport, passengers coming from destinations the authorities here consider a risk are guided to a special facility where the entire flight get tested for COVID-19. Blood samples are taken. Thanks to the rapid test kits Egypt recently received from China, the results are ready after just 15 minutes.
The rapid test kits made a big difference because they are more precise than measuring temperature. Recently, we've detected many cases before people even displayed symptoms.
I think these are crucial steps. Honestly, I feel comfortable when I see these measures. On our way here, nothing happened at the airport. My brother went back to Germany this week. In the airport, there are no checkups. That makes us concerned. What I see here makes me feel Egypt is a responsible country.
There was a lot of panic involved, but like in Toronto, it was like more, it was safer, I guess, for me personally, because the airport wasn't as crowded as JFK. So I felt safer there. And then when we got to New York, I was like, people weren't wearing masks or anything, and it wasn't taken care of, like, khalas. So yeah, that was when I started panicking. So it makes me proud, like, to come back and like, it's way safer here. I feel safer here.
Once they get notified of a case, the Egyptian authorities begin investigations. They isolate everyone who could be involved.
When a case emerges, we take samples from all who came in contact. For one case, the number of those who came in contact directly or indirectly was 3,875. Among them, 2,550 in his company. All of them have been quarantined. We've deployed 3 medical teams for them to follow up with them.
The Egyptian armed forces are leading a massive disinfection campaign to sanitize all public facilities and locations in the country.
There are extreme measures being taken in Egypt. Anything that could present a source of threat to the Egyptian people, even by a minor percentage, we will not hesitate to take any measures to stand against any possible infection.
Egypt has currently closed its airports to international flights. Schools and universities are in a lockdown. This week, prayers in churches and mosques have been stopped, and commercial stores have been ordered to close every day at 7 o'clock in the evening. Museums and tourist sites have also shut their doors. Egypt is doing its best to stop the wave of COVID-19 infection. Adel Mahroui, CGTN, Cairo.
Well, time now for our Correspondent's Perspective segment. In March 2020, the Democratic Republic of Congo, which has been battling Ebola, saw the last Ebola patient discharged. Our correspondent, Chris Ochomringa, was there to witness this major achievement. Earlier, I spoke to him to understand how the DRC is handling another infectious disease just after battling Ebola. Just talk us through what the mood in the country was like when that last Ebola patient was discharged.
Lindy, there was a lot of excitement, especially in Beni, one of the epicenters of the outbreak. And not just there, but across the country. Congolese people have been living in fear for 2 years because of the Ebola outbreak. And so people danced and celebrated. They're saying now the disease is coming to an end and their lives will go back to normal. But healthcare officials have told them not to celebrate yet because they have to wait for 42 days to pass before they declare the outbreak over.
Certainly that is a milestone in itself, but it must be something of an anticlimax for the people of the DRC to have learned about the COVID-19 outbreak. Just tell us how the country took this news.
Well, there was a lot of fear, there was panic and there was anger. But people have now come to terms and they've had to change their way of life because they have been following what's happening across the world, the number of deaths, and this being the capital city with a population of about 13 million people, there's fear that, you know, if the disease really spreads, it will kill very many people. So very big change in how Congolese live their lives. Many Congolese are fun-loving people, and so they will have to keep away from such gatherings, and that is really going to is all aimed at, you know, preventing the spread of this disease. Lindy?
Chris, tell us what lessons were learned in dealing with the Ebola outbreak that can be applied now in the fight against COVID-19.
The first lesson is about surveillance. It's a very critical issue. You know, when this Ebola outbreak struck the DRC, many health officials confused it for other ailments. And so they did not give the right treatment, they did not isolate people, and that caused the disease to spread. But then after international health experts came in and, you know, confirmed that this was Ebola, they put in place surveillance mechanism to detect the disease early, and they have spread it across the country, not just in the east where the outbreak was occurring. And so that is also something that they're doing with coronavirus. They're training all healthcare workers across the country to be able to detect coronavirus and isolate people quickly, so that it's going to be part and parcel of the healthcare strategy in the DRC.
Join us again tomorrow as we take a look at COVID-19 and its impact on trade.